Welcome everyone, Dr. Mandell here. I am going to share with you something very special. What's so special about it is that we're going to focus inside the ear. There are neurological centers that's tied into the autonomic nervous system, particularly the parasympathetic nervous system. The vagus nerve, which is the longest nerve of the body. We call this the great wonder protector of the body. This is what relays information from the body's internal organs to the center of the nervous system. When this vagus nerve exits out of the cranium, it provides innervation to the soft palate, the pharynx, the muscles of the throat. Then it makes its way into the chest region, affecting the heart, lungs, liver, adrenal glands, as well as the gastrointestinal tract up to the splenic flexure of the colon. Now this complex, miraculous nerve communicates with all these different organs, and it sends messages through the central nervous system to the brain so it can have proper communication that things are working correctly. Scientific literature proves that the vagus nerve has a gut-brain connection. When you think back in the past, you put your hand on your stomach, or you said, "My gut feeling thinks," that's a connection right to the brain, and it's usually right. So the vagus nerve is a part of the parasympathetic system. That is the rest and digest. That's what slows you down, takes away anxiety, puts you to sleep. It allows better digestion. This is healthy for us. This is what we need. The other side is the sympathetic nervous system, the fight or flight, the adrenaline, the stress. That's what we don't need. The best way to kick in that parasympathetic autonomic nervous system, utilizing the vagus nerve, particularly in our organs within our system, is deep breathing exercises. But we're going to bypass that today. I am going to show you something that's going to make you really happy. My technique is based on an auricular branch of the vagus nerve, a small sensory area that's located in the ear. Auricular means ear, and this peripheral branch of the vagus nerve mainly supplies inside the ear and the ear canal, as well as the tragus. So let me demonstrate on my ear. Here is the tragus, this part right here. All inside right here, inside the ear, is all controlled by the vagus nerve. The ear canal, all through the canal right in here, is all controlled by the vagus nerve. If you ever had your ears massaged, you probably remember that tranquility, that instant relaxation, like you want to fall asleep. That's because the vagus nerve is being stimulated. You're getting afferent sensory bombardment to the brain. The brain is then being stimulated, sending messages through the entire parasympathetic nervous system, as hormones and chemicals are then secreted from the brain, affecting your entire body, giving you that instant tranquility. So now that you understand the physiology and neurology behind this science, let me show you how simple this technique is. The vagus nerve affects both ears, so we're going to stimulate both of them together to get better results. This is what we're going to do first. We're going to work with the tragus on both ears. This is the tragus. Take your thumb, put it all the way inside the ear to where it doesn't move anymore. Take your other finger, your second finger, and grab the outside of the tragus. Here's the other side. Thumb goes in the ear. This second finger grabs the outside of the tragus. Now what I want you to do is that you're going to pinch and pull, but as you go in as far as you can go with the thumb. Stop, grab the tragus, pinch it and pull out. And just keep doing this. This is what it looks like. And it's going to go shh, 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 shh. You should feel and hear a whooshing sound. Just do that for 20 seconds. Okay, grabbing it here, as far as I can go in, grabbing it and pulling it like this. 20 seconds, just like this. You're going to hear a whooshing sound. That's what you need to hear. Now this last part is very powerful because the majority of that branch of the vagus nerve supplies the ear canal. We cannot go in the canal. we're going to use our thumbs. So we're going to go just on the outside of the opening of the canal. When you take your thumbs, you put it inside your ear, you'll put it as far as it can go to where it stops, and you're going to rock it up and down. Do not push hard. Just stimulating the surface of the skin will stimulate the vagus nerve. Put your thumbs inside your ears, and you're going to go up and down. You'll feel a whooshing sound. You'll hear it. Go up and down, nice and gentle. Do that for 20 seconds. And we're stimulating that branch of the vagus nerve. You don't push hard. 20 seconds. Relax. Now you're going to notice within seconds, some people maybe within a minute, 2 minutes, you're going to start winding down, coming down. You're going to feel instant relaxation, tranquility, anxiety starting to melt. This technique you can do any place and any time. You can do it before you go to bed. You can do it when you're in tough and rough and stressful situations. Do this technique because it will lower your pulse rate, your blood pressure. It will calm your nervous system down by kicking in that parasympathetic nervous system. Please share this technique with your friends and family. Leave your comments below, and most important, make it a great day. I'm Dr. Alan Mandell.